Hi everyone, a very good day. Hope all of you are doing well. Myself, Dr. Jogendra Kumar Bastia, neurophysician, SK's Neuro Super Speciality Hospital, Hyderabad. Dear friends, today we will learn about a very common health problem, brain stroke. A brain stroke is one of the most dangerous conditions affecting the human brain. It happens suddenly, without warning, and can change a person's life in seconds. So let us understand it step by step. What is a brain stroke? You know, brain controls everything. Your thoughts, speech, movement, emotions, breathing, and memory. To work properly, the brain needs a continuous supply of blood, oxygen, and nutrients. A brain stroke happens when the brain does not get enough blood supply. Without blood, brain cells begin to die within just a few minutes. Once brain cells die, they don't recover. This is why brain stroke is so serious. Think of it like a power cut in your home. When the electricity stops, lights and machines shut down. Similarly, when blood stops, your brain switches off part by part. So what happens when we get a stroke? Because the brain controls the body, any damage to the brain causes problems in the body. Depending on which part of the brain is affected, we may experience sudden weakness or paralysis in one side of the body, face, arm, or leg. There may be speech problem, speaking unclear or not able to find words. There may be understanding problems, can't understand what others say. There may be vision loss, blurred vision, or double vision. Some patients develop sudden confusion. There may be loss of balance or a dizziness sensation. Some patients may have severe headache, especially if there is a bleeding type of brain stroke. These symptoms appear very suddenly. Stroke doesn't happen slowly over days. It comes like a sudden attack. So, how does stroke happens? Two main types of strokes. There are two basic main types of stroke. The first, the most common one is ischemic stroke. That is a block in the blood vessel of the brain. 80 to 85% of strokes, a blood vessel that carrying blood to the brain becomes blocked. This block is usually due to a clot formed inside the brain artery, a clot traveling from the heart to the brain, or it may be a fat or cholesterol buildup narrowing the blood vessels. When the blood path is blocked, the brain starves of oxygen, brain cells die. This is the most common type of stroke. The second type of brain stroke is hemorrhagic stroke, bleeding inside the brain. 15 to 20% of strokes, a blood vessel in the brain bursts and starts bleeding. The leaking blood damages brain tissue and increases pressure inside the skull. This happens when the blood pressure is very high blood pressure, or when a weak artery ruptures and leaks the blood, like brain aneurysm. Or sometimes blood vessel malformations, abnormal blood vessels can break and starts leaking blood. These strokes are less common, but usually more dangerous. So why does stroke happens? What are the root causes? Stroke does not happen overnight. It usually happens due to long-term health problems or unhealthy lifestyle habits. The main reasons are high blood pressure, hypertension. It causes damage to the blood vessel. It causes narrowing or bursting or breakage of the blood vessels. Second, diabetes. High blood sugar damages brain and heart arteries, may cause clots inside the blood vessel. High cholesterol. Fat deposits in the blood vessel, narrows the passage, or sometimes it can cause blockage. Smoking. Toxic chemicals present in the smoke damages the blood vessel wall and increases the clot formation inside the vessel wall. Obesity, too much body weight, increases the fat level in the body and also increases BP and blood sugar, cholesterol simultaneously. Lack of exercise causes unhealthy blood vessels and increases the clot risk. Any heart problem, irregular heartbeats cause clots in the heart that travels to the brain and cause stroke. Alcohol, excessive alcohol drinking weakens the blood vessel, increases the blood pressure and can cause brain stroke. Poor sleep, excessive stress that can also increases the blood vessels thickness and cause brain stroke. Family history, if any patient has a history of brain stroke to other family members, they may have some genetic problem that may cause brain stroke. Different real life reasons like situation that silently increases the stroke risk, like eating excessive fast food, fried snacks which increases the blood cholesterol level, sugary drinks, soft drinks containing high sugar that may increase the blood sugar level, blood fat level and cause brain stroke. Eating too much salt that increases the blood pressure and may cause brain stroke. Smoking or drinking. Sitting all day causes slow circulation of the blood, so it can cause brain stroke. Poor sleep, stress, anger, all these things harm the heart and cause brain stroke. Skipping checkups. Small problems become big. Most strokes are not bad luck. They are the result of years of unhealthy habits. So stroke is a true medical emergency. It does not wait, it does not warn. Every minute is very, very important. Delay means more brain damage. Remember, control blood pressure. Check blood sugar and maintain it within normal limit. Check cholesterol level and avoid smoking, tobacco. Get enough sleep, do some exercise, eat healthy food, do regular health checkups. If someone suddenly cannot speak, cannot walk, cannot raise his arm, cannot smile, has facial drooping to one side, rush to the nearest hospital because it can be the beginning symptoms of stroke. Don't wait, don't search for home remedies. Timely treatment can save the brain and save a life. Thank you.